Hi, this is Lisa Miller. I am the founder and principal advisor here at VIE Healthcare, and we work with hospitals to provide them with expert resources in reducing their non-labor costs, particularly in the OR, high-cost items, physician preference items, and purchase services. And today's short video will be about purchase services. For the last 17 years, we've specifically developed a core competency in purchase services. And many of our analysts come to us with 10 to 17 years of purchase services expertise. And our benchmarking database amasses probably one of the industry's largest databases in purchase services in over 200 categories. So today we're going to talk about lithotripsy. And many hospitals outsource their lithotripsy services. And there's some challenges and some opportunities as it relates to looking at lithotripsy and reducing that spend. So what is lithotripsy? It is the most common procedure for kidney stones, and typically it's performed on an outpatient basis, right? So it's a same-day procedure. However, it does require pre-admission testing. There is about anywhere from 40 minutes to 70 minutes of OR time, and the costs include you've got medical supplies, you have drugs, you have lab testing, you have pre-op, post-op, and anesthesia time. So there's a lot of costs that go into lithotripsy, and we're going to talk a little bit about how you can analyze those costs. And the big question we're also going to answer is, are you losing money or are you making money on lithotripsy services? So first thing we need you to do is get your contract out. We want you to review it for pricing and for structure. Many lithotripsy contracts are tiered. They're tiered based on what payer. So we want you to pull out the contract, look how the pricing structure is formulated, and also if there are other costs that are included. Second thing we want you to do is go get 3 months of invoice sampling. We want you to look at current spend trends and to validate, are you actually paying for what the contract says you should be paying for? And like I said, many times it's based on payer. So we want you to match that up and make sure that your invoices reflect what your contract says. So here comes some challenges. Many of the outsourced providers are physician-owned, and there's typically a high sensitivity around these relationships and how we approach talking to the facilities about potential cost reduction and pricing reduction. Ideally, we want to get to best-in-class and competitive pricing. So our suggestion here at VIE is to seek accurate benchmarking, right? There are many different ways you can get accurate benchmarks in the marketplace, and the other way is to support it by an internal benchmark. And an internal benchmark, the best way to do that is to understand what your true costs are, what your reimbursements are, and then be able to understand true profitability. So we start with mapping to reimbursement. The CPT codes for lithotripsy are 50590 and 52332. So the 50590 is for standard lithotripsy, and the second is for a lithotripsy that was a secondary procedure. Medicare has different reimbursements throughout the country, but on average, the Medicare reimbursement for lithotripsy is about $2,700 to $2,800, and for outpatient for your ASC is approximately $1,600 to $1,700. And so when you're looking at your payer mixes, of course you need to look at Medicare, Medicaid, managed care, and of course you want to add in workers' comp. But traditionally those three are the most important that you need to look at. The other area you need to look at is competition. Are there other providers of services in your area? Are there national providers? And what's really, really important is that since there is at times those relationships with physician-owned facilities or joint ventures, Medicare requires hospitals to benchmark and to pay for these services at a competitive rate. And so our suggestion, as now that you've looked at your contract, you've looked at your invoices, you've looked at reimbursement, what we like to tell our hospitals is that you should get one fair price, one competitive price for all payers, right? Regardless of the payer. So we need you to look at your detailed patient billing, and again, we gave you those CPT codes earlier, and analyze your cost per case by physician, by payer. And I think what you'll see is, and what most hospitals are very, very surprised about, is that it uncovers their true profitability, and many times they're either not as profitable as they thought, or they're in fact losing money. And if you think about all the costs that go into a lithotripsy case, in addition to your outsourced price for lithotripsy versus what Medicare reimburses in your managed care, you'll see that there's a lot more that adds up to the cost for a case for a lithotripsy. VIE has over 17 years of purchase services expertise, and we have the industry's most comprehensive purchase services database. One of our goals in putting together this video is to help you and your team at your hospital really uncover all the opportunities that exist in purchase services spend. So one of the things that we want to do is to give you some free offers. And so you'll see that there's an opt-in button on the page there. So we want you to put your email, your name, and your information. And what we're going to do is give you a number of free things. If you're a hospital executive in supply chain, you're in finance, or in your operations, we're going to give you access to what we call is our procedure profitability analysis worksheet. And it's a template, it's plug and play. It helps you do what we talked about today, which is analyze, put the data in for lithotripsy, put your cost in, and right away you'll be able to immediately find out if you're profitable in lithotripsy or other areas. So we're going to send you that template for free. Number two, we're going to send you the transcription of this video for free. You'll be able to kind of be able to see some of the CPT codes and read through some of the things I talked about, so you'll get those for free. We have just created a new publication, and it's called Purchase Services Pricing Strategy Report. And so this monthly report we are giving to hospitals. Again, hospital CFOs, COOs, finance directors, supply chain. So this report will be the definitive guide to purchase services. And every month we'll be speaking about several different purchase services, kind of like we talked about today in lithotripsy, trends in the market, new price points or new opportunities that exist. And so if you work for a hospital and would like this annual free subscription, we're going to send it to you. Our inaugural copy will go out at the end of the month. Again, purchase service pricing strategy, monthly report for you, for hospital executives. If you're not a hospital and would like the annual subscription, it is $36,000 a year, and you can email myself at lmiller@viehealthcare.com, and we can get you the right person for that subscription. This monthly report and annual subscription is free and exclusive to hospitals. It will have tremendous value. 1 month's report will really give you a nice roadmap for opportunities and what to look for in your own organization. And finally, for those hospitals who need some extra resources, or who are searching for purchase services benchmarking, and you need help immediately to reduce your costs, we're offering for the month of May, so through May 31st, 2016, we're offering one of your purchase services at no charge. So you can send us a purchase services agreement, and we'll perform that benchmarking analysis, the opportunities that exist, and help you achieve cost savings in one of your actual purchase services agreement. And so again, you can email me at lmiller@viehealthcare.com, and we'll get you to the to the right people so we can do that analysis immediately. So I want to thank you for watching the video. I hope you found it incredibly valuable. If you've got questions about what we talked about today about lithotripsy, please email me. Otherwise, opt in and receive the free subscription to Purchase Service Pricing Strategy. Please take us up on our offer for the template, for the transcription of today's video, and also a free analysis of one of your purchase services contracts. So I look forward to meeting everyone, and thank you for spending the time with me on today's video. Have a great day.